This meeting is being live streamed.
सर गुड इवनिंग।
चालू नहीं हुआ।
हाँ सर, आप कंटिन्यू कर सकते हैं सर।
ओके।
मुदस्सर सर से बोल के कंटिन्यू करवाओ।
हो गया नहीं सर।
हाँ
सर जहाँ से चालू था सर। हेलो।
हाँ बोलो
सर तो वही से start
नहीं, लाइव स्ट्रीम अरे कहीं से भी चालू करवाओ ना, स्टार्ट करो। स्टार्ट करो।
No, I am discussing about dosage. My dear doctors, I have to take the lecture on this thing. Discussion on dosage reduction strategies and rabies management, role of novel vaccine. As you know, these Kerala people, they have introduced this rabies, which is very affordable, and only dose schedule is very distinct. Only 3 doses has to be given, and immunity lasts for the longer time. So this is the beauty of this product, and immunity is also lost long. So we come to rabies. As you know, rabies disease is caused by it's a genetic disease caused by rabies virus, and you know other especially by the dogs, but other animals like monkeys and jackals and this thing, even squirrels, bite is reported, and in South America these pets, because they are sucking the blood, so they are known to cause rabies infection. As you know, this is caused by the rabies virus, and it's having the this rabies is this having the protein, different protein virus and encoded by the 5 structural proteins. G protein, which is very important, which is the major antigen in the formation of neutralizing antibody against rabies, and very difficult to preserve and stabilize it. So these Kerala people, they have managed to stabilize, and this is one of the more important ingredient to increase the immunity, and this is the important part of the vaccine. So the other protein like N protein, P protein, and M protein, and RNA and L protein. So this is the structure of the virus. So P protein is the major, very important. Then we come to epidemiology. As you know, globally 59,000 people, the rabies death per year is reported. In India, 20,000 rabies death, and in this 90% of the death is in rural area. So as you know, this is a major problem as developing country, because dog bite common and dog population is exploding. You know, as you do multiply, because which give at least 6 to 8 pups every year. So you can imagine the population of the dog. And this Manka Gandhi, as you know, they have stopped, and they have this precedence was there will be no dog poison being given. So because previously dog poison was given like a strychnine, so this problem was little bit solved. But now that has been also due to this objection by this politician. So this population of dogs is increasing. This population is increasing and giving rise to more social harm. So pets, even in pets, people, they are keeping the pets in India, but most of them, they are not vaccinated. And they say, "Bhai, हमारा घर का पालतू कुत्ता है," but they are roaming around and mixed to the other dogs and give rise to rabies when they bite. So this is the problem also. But contrary, in a foreign country, they are very strict. They are keeping their campus also, and they have the gardens, and they are having the different facility for the dogs, and they don't allow to move their dogs to mix with the other stray dog. There is no stray dog in the USA. So this is the difference between India and all, and rural area also. They are not so much educated, and even after dog bite, so they are not careful and don't go to doctor. Even they are not getting the facility in the PSC also, because anti-rabies serum, they are available in also there. And that problem is that old traditional this bits because झाड़ फूंक से उन्होंने कहा था वो गए उन्होंने मिर्ची लगा दी इसको पता चला वो मिर्ची लगा दिया उसने उन्होंने कहा भाई ठीक हो जाएगा झाड़ फूंक कर दी एंड उसमें क्या होता है कुछ केसेस जो रियली जो वैक्सीन जिसमें रेबीज नहीं था है जो इन्फेक्टेड जो नहीं काटे थे वो तो ठीक हो जाते थे तो दे वर थिंकिंग भाई झाड़ फूंक से ठीक हो जाते हैं दे डोंट इवन थिंक don't think to take vaccine also. And suppose they are going for vaccine, they will say this is very expensive. They will take only one. Not but that is the problem. This financial this problem with poor people also in rural area also. So they will not even follow the regime. So that this will not give you the immunity and they suffer from this. So this is very common in rural area. And this drug, even this thing. Program of sterilization was started here, but you know that was failed because that was only on the papers. Really, the sterilization, if it has been properly followed, so that has been done a very good thing. So false reporting on papers only, there is no sterilization. This is successful. Then due to this this problem. So this is a very common problem. Now this we come to rabies. Rabies, as you know, I will little talk about the rabies infection. When this dog bite happens, then people should, as you know, people they know that should be properly cleaned. So preferably suppose we will get soap that is cleaned with detergent soap and antiseptic and betadine like even spirit that is very helpful. And that wound should not be sutured, not should be stitched, that should be kept clean. And suppose it is a rabid dog bite, so that has been infiltrated the rabies serum also infiltration very important to prevent the spread of the this infection. But for prophylactic and for curative, we have to give the vaccine. The source of infection is saliva. That is the source of that is only when even lick of the dog is very important. When licking of the dog means there is penetration of the virus inside. Saliva is the more contagious when and this ATS should be given to prevent the tetanus because there is no the dogs they are usually eating there are some dirt and this thing. So we have to cover with the antibiotic and wound should be clean. And that antibiotic systemic and local antibiotics to be admission to be done. And previously, you know, there's 14 injections were given. And abdomen, there people they were afraid कि भी हमें 14 injection लग जाएंगे तो people they were afraid of dog because the 14 injection लग जाएंगे. And that you know that was very side effects are very much that give rise to neurological symptom like quadriplegia, paraplegia, and all. Because I know I have seen my Professor Mukherjee in Jaipur Medical College, and he has taken this anti-rabies treatment. At that time, there was brain emulsion, brain emulsion vaccine was available, and he developed quadriplegia. And that he was in the bed for 6 to 7 months, and very after 1 year, he gradually recovered. So this was the problem with the vaccine previously was used. And you know, rabies is 100% fatal, but 100% vaccine preventable disease also. So vaccination is very important in rabies, but people they ignore and do not sometimes avoid to take vaccine. But vaccination is protective and 100% protective, and we have to see which vaccine is more preferred. So evolution of the rabies vaccine, as you know, previously live attenuated vaccine, the spinal cord vaccine was introduced in 1885. That was non-standardized dried preparation. Up to 31 injection of the increasing immunogenicity. Even then, that was not so protective, pseudo-protective was not this thing fine. Then came the inactivated vaccine brain extract. In particular, Seep's brain extract was taken, having a lot of complications and 14 injections have been given, and there was no surety for the immunity also. Certain people, after giving that injections also, they have developed vaccine and quadriplegia neurological disorder. And particularly, this very painful affair where people were quite afraid of taking the Chauda injection. And they said, we have a Chauda injection. Even few injections they used to take and avoid to take all the injections. So this was the problem with, and because it was painful and this given out in the footage intra-abdominal this thing. And sometime this non-technical person, they used to inject in the peritoneal also to peritonitis, and sometimes cystitis was also reported. So now this cell culture was the introduced inactivated vaccine. This standards immunologically lyophilized. So 5 injection has to be done. As you know, region 0, 3, 7, 14, and 28. So, but zero protection was not so optimally, it is not maintained. So current challenge is the preservation of the cell. So we have to inconsistency in potency, stability, short supply, and adverse events. So this has to be kept in the mind, and these people, they have introduced the Travis vaccine. And as you know, this Travis vaccine introducing there is first vaccine with 3 doses, intramuscular region 0 to 37. And this is particularly virus-like particles, monoparticles, prepared by, this is known as VLP. This is virus-like monoparticles, nanoparticles, VLP platform technology, and first protein submit vaccination. So better compliance due to easy to flow regime and less variant, because you have to go for only 3. So sometimes what happened, 5 injections, sometimes missed. People, they are busy, they have gone to some outside of their, they forget to take the, and that is the problem. So only 3 injections they have to take. So that is very easy to take, and 037, and there's convenience, ready to use. But there's no need of reconstitution. Already reconstitution constituted this vaccine. Then I will talk about the VLP technology, virus-like particles. That is very important, and that is the main ingredient, and that is the beauty of this this vaccine. So this G protein is difficult to stabilize. G protein isolation using VLP technology, purified and stabilized by Cadila Pharmaceutical. So virus-like particles are protein complexes exist as a nanoparticles, and VLPs are similar to native viruses particles, but they do not contain the viral genome. So there is no infection as rabies. They are, although they are containing the viral genome, but they are not pathogenic also. So they don't produce disease. The virus particles are protein complexes exist as nanoparticles, and they are capable of inducing a strong humoral and cellular immune response. So they are different from the original rabies virus, although they have the same genome, and but they are able to introduce, they are produce antibodies and humoral and cellular immune response. So they cannot replicate, but can mimic the viral antigenicity without being pathogenic. They don't replicate, but having the efficacy of introducing antibody production, and they don't produce the disease as such because they don't have the property. Then VLP technology as this no original research from Cadila and artists, as well as the scientists from here, Dr. Sumit Poddar, Ashok Agrawal, Dr. Amit Soni, and Seema Sharma. By their efforts, they have been able to stabilize this G protein and able to form, successful to form this vaccine. Then clinical phase, as you know, zero protection, because this has to be given only 3, and other like Levipur, there has to be given 5 injections. But this zero protection rate is very high. In 14 days only, this level achieved. Why in rabies after 42 days that level is reached, which is seen in the other listing. Then clinical study phase, safety and immunogenically and novel 3-dose recombinant non-particles rabies G protein vaccine administered as a simulated post-exposure immunization, randomized comparator control multi-center phase 3 clinical study. And one of the better thing about this, and this can be safely given to the pregnant ladies and after 15 years. And there no side effects have been reported like others. this duty of this vaccine. And randomized comparative controlled multicentric study. Total 800 subjects had been taken, and 037 in this vaccine. Rabies may you find 5 out of 533 subjects. They have been they have achieved antibody level, maximum antibody level within 14 days. While other by the rabies, 533 subjects has gained the optimum and maximum antibody level at 14 days, but other vaccine they took on for the same antibody level for 42 days. So this is the difference. So this is very efficacious, effective, and the antibody lasts for 1 year. So there is no even booster dose is recommended even. But in other vaccines, booster dose can be recommended because antibody platelet that has come down and has to be antigenic stimulation has to be done. Then study design and objective, demonstrable non-inferiority in the test vaccine is the comparator vaccine. Primary objective, subject with a seroprotection 14 days, as you are already told you, post first seroprotection and by 0.5 ml, 0.5 international unit, and secondary objective, subject with a seroprotector at day 42, first dose of test vaccine, safely for monitoring safety with adverse event. So this is safe, there is no side effects. So as you know, they have done the various awards for their efforts, and beautiful product they have launched by the Kerala. And this is this Pharma Innovation of the Year by the Economic Times. They have won the award for this achievement, and the Golden Globe Tiger Award in Malaysia for Innovation Product of Year. And this is in the brief about the rabies vaccine. Thank you. G protein, as you know, G protein is much better as compared to other vaccine. Contains chick embryo virus. So this is superior to other chick embryo vaccine. G protein is very important. This G protein they have been able to stabilize it.
आपके पास क्वेश्चन है सर के या मैं देखूं? Sir, good evening.
Good evening. Good evening.
How are you, sir? Sir, sorry, some a little bit technical glitch was there, but still we have participants waiting. We're waiting for the question answer, sir. So, yes, sir.
But sorry, because I have to go to clinic 5 o'clock and one patient is waiting.
Okay,
He is
no.
having my this very problem. He
Okay,
developed my very seriously.
Right. So, sir, thank you so much, first of all, for your informative session. एक दो question है, sir, which I want you to just answer and then maybe we can complete this session. One question has come regarding the animal bite, that apart from dog bite, any other animal bite cases are you checking?
Jackal is very common. CR or जो होती है, that is very common. And
Yes, sir.
monkey bite, even squirrels, reported squirrels का bite, that's very reported. And
Yes.
in South America, this pets, because they suck the blood, bite and
Right.
suck blood. Yes.
Right,
So
right.
along with the only dog, they are not responsible. The other species of the animals, they are also known to cause rabies. And the monkey bite is very common. Monkey bite, jackal, even I have seen my in clinic also about
Right,
2
sir.
years back. One of the जिसको सियार बोलते हैं ना,
जी
jackal.
सर जी.
वो
Jackal.
Saliwala, there's a village like Saliwala, and he has bitten that CR has bitten 3-4 people, and
Right.
out of them died. Out of 2 dies rabies. So
Oh,
the jackal, CR, monkey, squirrel you have never imagined squirrel से भी होता है.
right,
And
sir.
cat bite sometimes, cat bite also.
Right, sir.
And even when this dog bites to cow also.
Hmm.
Sometimes because salivation is there, and
Yes.
if he bites to someone, then but not
Yes.
known, but maybe because saliva is the this thing, the
Yes.
source of infection. And after this, these bacteria, they rise, they are secreted in the vaccine. So these are the 4 distinct categories. They are of animals. They are known to cause rabies virus.
Okay, sir. Right.
Thank you.
Sir,
So
another, sir, one more question I just want you to take, and then maybe we can close this session. This is related to benefits of 3 dose over 5, and if you have any clinical experience regarding that, you can share with the participants, sir. अगर
Which one?
कोई clinical experience आपका है, sir, our Thravis, if you have passed the benefits of Thravis to any of the animal bite victim, so if you want to share some experience in terms of patient compliance or benefits.
rabies has been recently in about 1 year, I think.
Right,
1
sir,
year
right.
completed.
Ji, sir.
So people, what happened actually? The problem is that in
Yes,
our country, the people they are not, they are very reluctant and confused type के लोग बहुत रहते हैं. उन्होंने कहा साहब एक ही
Yes.
वैक्सीन जो है बहुत है. आप समझे ना, this is the problem. जो
Yes,
5
sir.
वैक्सीन लगवाते हैं उनमें जो रेबीपुर करता था, उन्होंने कहा साहब वो 3 लग जाए, करना क्या है, बड़ी मुश्किल से उनको convince करो. अब उन्होंने कहा साहब बड़ी महंगी है. अब कई लोग क्या, even they can afford, but they don't want to take the vaccine. अब you can't insist them, you can't force them.
Yes,
है
sir.
ना? So that becomes the problem with the public, because
Yes.
educated certain people, they qualified, they can come to know and they will realize and they will take it. But
Yes,
I have seen the majority of the people, अरे साहब 2 इंजेक्शन बहुत है, अरे साहब एक इंजेक्शन बहुत नहीं हो जाएगा, उनको समझाते रहो, उसमें सिर फोड़ते रहो, कोई मतलब ही नहीं.
Yes,
So
sir.
this is the problem we are facing with the clinic. अब उन्होंने कहा साहब ये आप जो वैक्सीन लिख रहे हैं, this is more expensive, 4 से कुछ की पड़ती शायद, 700 की पड़ती है, वो जो है 350 370. तो उन्होंने कहा साहब वो आपने महंगी वैक्सीन लिखी, सस्ती क्यों नहीं लिखी?
Yes, sir.
उनको कौन समझाए कि इसमें आपका डी प्रोटीन है, उसका जो एंटीबॉडी स्ट्रक्चर अच्छा है, उसकी
Yes.
एंटीबॉडी जो लॉन्ग सीरो प्रोटेक्टिव रहेगा, अब वो समझने को तैयार कहाँ है? तो
Absolutely.
उससे पब्लिक को कन्विंस करना बड़ा मुश्किल होता है. उन्होंने
Yes.
कहा भाई आपने वैक्सीन लिख दी, उन्होंने बदलो महंगी वैक्सीन लिख दो, वो एक ही लेके रहेगा, पता चला. अच्छा, sometimes one of the problem because people they are very particular to take it, but जैसे अभी एक पेशेंट में महाराष्ट्र का था, सोलापुर का, he was not there, उसको मिली नहीं वहाँ वैक्सीन. ये प्रॉब्लम कई बार हो जाता है. वैक्सीन अपने इतना, क्योंकि इतना पॉपुलर अभी बीच में थोड़ा पॉपुलराइज होगी, जो
Yes.
होगी, मगर कई लोग तो नहीं जानते ना, उनको जिसको आओ साहब रेबीपुर लगा दो,
Yes.
जो टंग में जो रेबीपुर लगा दो साहब.
Yes, sir.
So this is the problem we are facing. Public जो है
Yes.
वो यार उनके पॉकेट कई लोगों का परमिट नहीं कर रहा, जिनका परमिट करता है वो बहुत रिलेक्टेंट है, एंड दे आर माइंड आल्सो एंड दे डोंट वांट टू स्पेंड, और उनको कॉम्प्लिकेशन समझ ही नहीं आता. रेबीज उनको अब ये ऐसा होता तो उसको बड़े इजी वे में लेते हैं. दिस इज द प्रॉब्लम वी आर.
Yes.
हाँ, because in India this is the problem. In other country, foreign country, you can find this because they are very particular. Even for class of qualified and educated people जो है थोड़ा सा समझ जाते हैं.
Yes, sir. Yes.
गाँव वालों को विलेजर्स को ट्रीट करना पड़ता है ना. मेजॉरिटी विलेज से आते हैं, उनके साथ बड़ा प्रॉब्लम होता है कन्विंस करना.
Absolutely. नहीं, ये बात सही है, सर. और लेकिन सर, yes.
उसके बाद बोलते हैं साहब हम ऐसा नहीं, अस्पताल चले जाएंगे, सरकारी अस्पताल. अब सरकारी पीएचसी एंड अदर हॉस्पिटल दैट इज नॉट अवेलेबल. ओनली डिस्ट्रिक्ट हॉस्पिटल में मिलता है, वो भी ना लाइन लगाओ भैया 3 दिन बाद मिलेगा, अभी अवेलेबिलिटी नहीं है, ये है, तो उसमें गैप वैसे ही हो जाता है, पूरा रीजन फॉलो हो नहीं पाता.
Absolutely. Yes,
ये
sir.
सब प्रॉब्लम्स होते हैं.
Yeah, but sir, let me tell you one thing. After as you rightly mentioned, that Travis has completed 1 year, successfully completed 1 year. Apna sir, 50,000, more than 40,000 individuals have taken this, and there is no cases of side effects or some vaccination failure have registered. So it means that's a very safe, highly effective vaccine. Sir, इसमें जैसे आपने बोला education program, now we have started more than 30,000 clinics में हमारा poster, हम लोग patient education poster सर लगा रहे. And today this webinar, like जैसे आपके साथ मैंने हमारा एक webinar था sir, across India 55 webinars at one time we are doing sir. So more than अभी जो मेरे पास जो number just अभी पहुंचा है sir, around 3,000 plus doctors के पास already हमने live आज देखा है. So it means that sir, ये जो education जितना हम educate करेंगे, not only to the society, even to the medical fraternity also regarding this 3 dose, तो awareness बढ़ेगा sir. So that is our aim, and accordingly then sir, जो India government of India का जो एक slogan है, to eradicate rabies by 2030, definitely we will achieve that. But उसके लिए सर सब जगह education और information पहुंचाना बहुत जरूरी है. Your thoughts sir before we conclude sir, because आपके patient भी wait कर रहे हैं sir. So I'm really sorry I'm taking more of your
Because
time.
I have mentioned this already. I have mentioned about the extent vaccine जो आती है.
Please.
Sir, good evening.
You might have heard. I have Dr. Mukherjee, professor of ophthalmology here in Medical College.
Yeah, sir. Yes, sir.
He
Yes.
has taken this and developed quality features. But after 1 year, he has a very dangerous system of side effects. पहले लक्षण का इंजेक्शन जो लगता है, कई बार क्वेक टाइप के लोग रहते थे,
Right.
जैसे कि भाई इंट्रामस्कुलर लगता है, मतलब वो प्रॉब्लम सॉल्व हो गया.
Right. But education and information is required, sir, everywhere.
Very important. And they should be convinced if it is a expensive, means that is not affordable, but that is equivalent to 3.
Yes.
This जो है, जो आपका है,
Yes,
that
sir.
is equal to only little bit expensive, पर उतना ही पड़ जाता है. भाई 5 लगवा रहे 3 उतना ही पड़ेगा, ज्यादा efficacy
Yes,
है
sir.
ना? That is more effective than that.
Yes, sir. Yes,
मतलब ये जो है कि तो समझाने थोड़ा टाइम लगेगा उसमें.
yes, sir. Yes, sir. लेकिन करेंगे sir, with the help of you and definitely will achieve that objective. Right, sir? So thank you so much, sir, once again for your time. And thank you all the participants for their time and joining us for this webinar. Thank you, sir. Thank you so much.
Sir, thank you.
Thank you. Thank you.
रील बोल रहा हूँ सर.
Thank you.
थैंक यू. मैं अभी बॉम्बे में हूँ, अभी बॉम्बे में हूँ. मिलता हूँ सर, जबलपुर आता हूँ तो मंडे को मिलता हूँ आपको.
Bye. Thank you,
Thank you.
sir. Good job done. Thank you. Bye bye.
Okay, sir. Thank you, sir.
Thank you.
Have a
Bye.
nice.
Bye.
Bye.